Well, in the past, speaking of childbirth, it was assumed that once a woman gave birth by C-section, all of her later deliveries had to be by C-section as well, but that may not be the case anymore. We are talking it over with Dr. Amy Ravin, a SLUCare OB-GYN. Good morning to you.
Good morning. Thanks for having me.
Good morning. I understand that about a third of deliveries in Missouri are C-sections. So what is the general rule regarding additional pregnancies for those women who have had C-sections?
Sure. So yes, Missouri really matches the national rate of C-section, which is right about a third of deliveries. But for the subsequent delivery, it really depends on what the woman desires. If she's had a prior delivery that's a low transverse, so that the C-section scar goes sideways on the uterus, then she can choose to try for a vaginal delivery.
Can a VBAC or a vaginal birth after C-section, can that actually happen safely?
Absolutely. Absolutely. And so the process of trying for a vaginal delivery after a cesarean is called a TOLAC, or trial of labor after cesarean, and the successful delivery is the VBAC, as you alluded to. And that is successful in somewhere between 60 and 70% of all cases. So the success rate is very good.
So what are the benefits to this procedure?
Well, there are many benefits. So it's usually an easier recovery, a shorter hospital stay, less risk of infection and bleeding. And also really important to many women is the feeling of empowerment that they get from successfully having a vaginal delivery.
Yeah, it's major surgery when there's a C-section. So would all women qualify this, or is this on a case-by-case thing?
This is definitely on a case-by-case thing. I would say most women are candidates for a vaginal delivery after a cesarean, but it's definitely something that she should talk with her provider, doctor, or midwife about. Because there are certain situations in which it wouldn't be appropriate. So somebody who had a vertical scar or an incision that went up and down on the uterus, or somebody who has reasons not to have a vaginal delivery in the first place, like a placenta previa, a placenta that's not in a good location.
So is the success rate pretty high for this procedure?
Absolutely. So it's 60 to 70% for all folks. That can vary a little bit depending on the individual factors for each woman.
Very good. Doctor, some good information. We appreciate you joining us this morning. And for those who want to learn more about this procedure, we'll have a link for you on our website as well as our Fox 2 mobile app.